The next thing I want to work on is some shoulder mobility exercises. Just gently start moving your shoulder blades back and forth on your rib cage, up and down on your rib cage, and feeling the difference between your shoulder blades moving and your arm bones moving. So start here on your hands and knees. This is going to be a little bit shorter distance between your shoulders and your knees than they are between your shoulders and your hips, rather than sort of right underneath. The closer your knees are in towards your wrists, the less pressure there's going to be on your shoulders, or the less weight, because your knees are going to take more of that weight, or your lower body's going to take more of the weight. So as you feel more comfortable, you can back up a little bit to more of a standard tabletop position. But let's start in first, because I want you to really work on feeling your shoulder blades roll up and down and back and forth on your ribs. And so from here, again, your index finger is pointing straight forward, your elbows are rolled in, so the eye of your elbow is again pointing forward, just like this. And from here, just shrug your shoulders so your shoulders get closer to your ears. So you're just shrugging your shoulders up, and then pull your shoulders down your spine. And your arms are really neutral here, so they're not bending back and forth, and they're not bending up and down. They're just neutral, and the movement is all coming from here in the shoulder and from here in the shoulder blade as it moves up and down the spine and up and down the rib cage. So again, let's just do 10 shoulder shrugs. So shoulders to your ears, shoulders down the spine, to your ears, down the spine, and 3, and 4, and 5, and 6, 7, 8, 9, and 10. And stay here for this next set. Rather than shrugging your shoulders up to your ears and then down your spine, this time you're going to protract and retract your scapula. So protracting your scapula, they go around forward, kind of underneath your armpits, if you want to think about it like that. And then they come together on your back. And so the movement pattern of your shoulder blades is coming from here, and they're coming around and forward, and they're coming back that direction, squeezing together on your back body. So again, press the floor away, roll the shoulder blades away from one another, and squeeze your armpits in together and sort of squeeze them underneath your body. And that'll help you feel like you're bringing your shoulder blades apart on your back body and underneath on the sides of your body. And then let it drop through again, squeeze your shoulders back, retract them, and then push the floor away, protract them. And let's do 4 more of these, and 3, and 2, and 1. Good. And from here, you can back your knees up a little bit, because the next part of this, we're just going to slide the hands forward and then let your chest fall through. And the goal of this is to start to feel some extension, some full extension at the top of the shoulder, and then the release underneath your armpit and in the side of the shoulder blade. And so again, you're just going to slide your hands out and then let your chest fall through and come back up. And this is a little bit of a strengthening exercise for sure, because we've got some core stability happening while you're sliding your hands out and then falling through, and just let that chest fall through and then come back up and reset and let your chest fall through and come back up and reset. And let's do 4 more of these. And inhale on your way up, and then 3, and inhale on your way up, and then 2, and inhale on your way up, and then last one, and then inhale on your way up, and just reset yourself in a nice squared up tabletop position here. we're going to do a threading the needle. We can do this several different ways. I'm just going to have you start by lifting your left arm up and reaching to activate the back of that shoulder, and then go ahead and tuck it through to stretch the back of that shoulder. This arm can end up doing lots of different things in this position. It can even go up and behind you and wrap around that thigh on the back. But for now, because we're really trying to stretch the shoulders and mobilize them, we're really just wanting this shoulder that's on the ground to get a good stretch across the back and across the back of that shoulder. And hold it here for about 30 seconds. And then again, come back up, pressing through your right hand and replacing your left hand next to it. And we'll do the same thing, just sort of lift up to activate the shoulder, open up the left, close down the right, and then tuck that underneath so you can see this again. From here again, this left hand can go anywhere from here to here. It can also reach up, and it can also tuck back and around if you like that. And that'll open up the front of the left shoulder while you stretch the back of the right shoulder. We can replace the hands again and come back up, and then come sitting, same direction here. You're just going to place your feet so your feet are straight, they're facing away from you, they're pointing away from you, and your fingertips are going to be pointing the same direction as your toes. They'll just be a little bit behind your hips. And what we'll do here is we're just going to slide your hips forward to get a stretch in the front of your shoulders, and then back. Now this may be enough of a stretch for you to come forward like this, and then back, and you may feel enough of an opening in the front of your shoulder that you don't need to do anymore. If you want more, you can pull your toes in, and as you come forward, pop over the top of your feet, and then let your thighs stretch a little bit and get just a deeper stretch in the front of that shoulder, and then come back again. And again, we're just going to come forward, right over the feet, stretching the front of the shoulder, and then we'll come back again. And again, we'll do 3 more of these, leaning forward into the front of the shoulder, and then back, and 2 more. Good. And then the last one, we're going to lean forward, open up the front of the shoulder, and lean all the way back. Good. That should get most of the shoulder and the shoulder blade activated, warmed up, and just start to understand where those shoulder blades are on your back, how well they move, and how evenly they move. They're all really simple, but not necessarily easy movements. If you've got an old shoulder injury, if you had surgery in your shoulder, there's all kinds of things that'll get really sticky around your shoulders and shoulder blades, especially in that rotator cuff. The rotator cuff is a group of 4 muscles that hang on to your shoulder blade and attach it to your humerus, or your arm bone, and then do things like rotate. But if it gets really sticky and injured over time with sports injuries or work injuries or just chronic use injuries, it's not going to move really well in all of these directions, in and out, back and forth. And so what happens is we lose parts of those movements, and when we start to do these shoulder blade mobility exercises, you may be able to roll your right shoulder blade way back but not roll it forward, or roll your left shoulder blade way up but not bring it back down. And slowly over time, doing these little bit by little bit and adding weight bearing to it will help loosen up some of those end of range motion restrictions and get a little bit farther into each of those movements and heal the tissue a little bit at a time. And so they're really nice to just start adding some blood flow, adding some movement, and really adding some understanding about where your shoulder blades are in space and how they move and function, and where the stickiness is or where the injuries are, that you can start to work through with really simple movements like this that again aren't necessarily easy but really useful to help give blood flow and start to increase mobility so that you can start to use them more in a more functional way on a day-to-day basis. But also, as you're starting any kind of movement-based exercise program, you can start to use them more in a really appropriate way that adds strength and flexibility and length to the tissue, which is always a healthier way to add movement rather than just very short ranges of motion We want to really make sure that muscles are moving in their full range of motion and activating them both in an eccentric and a concentric way of contraction so that we strengthen them in a really important way over time with length and with flexibility.